All right. Welcome everyone to our first ever climate change event for this chapter, like locally represented through our climate change community committee. We recently formed, actually not so recent now, it's been about a year since we formed, and it's really good to get to speak to you guys on this platform. So thank you for being here and being part of this event. If we could go to the next slide. Yeah, so these lay out the objectives for today. It is quite a serious topic, climate change, but we wanted to keep it a bit light and try and have a little more hope and work together and see ways we can collaborate to address this growing problem that all of us are facing and going to face, and particularly to protect our young ones who we care for. So you can see the objectives outlined here, but briefly we'll introduce ourselves, the Climate Change Committee of the AAP Chapter 2, California Chapter 2. We would like to hear from you as well. It's a little hard than in being in person. So if you can use the chat function freely, that would be great. We've incorporated some questions to get to know you a little better. So we want to hear from you, not only from this event, but moving forward. We'll briefly touch upon some of the high points of climate change and how it affects health, particularly pediatric health. And then what are some actions we can take both individually and as a group to move this agenda along, and what is all of our individual roles in this purpose. If you can move to the next slide. So as I mentioned, we are this event has been brought to you by the co-founders of this climate change committee. So we have myself, Priyanka, we have Karina, Aditi, Trisha, and of course, Tomas. And we'll each talk about how we got to know each other and got into this space real quick. And while we do so, please feel free to drop in the chat any questions you had, or like the reason why you have been here, or any information you would like us to know about you. So I'm Priyanka Fernandez. I'm a pediatrician and a preventive medicine physician at UCLA. And I've always had interest in the environment and how it interplays with health. But really during COVID, just being part of such a enormous shift in how things happen, I thought I should be more meaningfully involved in climate change work and addressing really high stakes issues. And that's how I got connected with different folks on this, on the committee. And that's why I'm here. Moving on to Karina.
Thank you, Priyanka. Hi, everyone. My name is Karina Mayer. I live in Los Angeles. I'm from the Washington, D.C. area and have had an interest in preserving our natural environment since preteen years. I practiced general pediatrics for 18 years and then turned my attention to learning and teaching about the health impacts of climate change in the last few years, as well as advocating for change and solutions. And part of that work is accomplished with my colleagues in this committee. Aditi?
Hi, my name is Aditi Maskar. I'm a pediatrician and preventive medicine fellow at UCLA. I've always been interested in climate change, and like many of us have witnessed the effects of environmental pollution and climate change factors on our kids' health. So I joined this committee thanks to Priyanka, who's our program director. And next to Trisha.
Hi, I'm Trisha Roth. Do you have a picture of me with my Miss Piggy outfit? I've been a fellow with the Academy since 1974, and I qualify. I'm a grandmother of 11, 2.5 to 17. And so I really, I've worked on substance abuse and tobacco control, and I think environmental tobacco smoke has set a setting for me in terms of environmental work. Thank you, everyone.
Excellent. Good evening, everyone. Tomas Torices, math scientist today only, although this is what I look like in the mornings anyhow. I am the executive director for the AAP California Chapter 2. I have been since 2014, and I'm very excited that we have such an engaged committee within our chapter. The Climate Change Committee has been doing a lot of research and publishing some articles in the newsletter. We have a web page that you need to check out later. So it's going to be a good evening tonight. Thank you for joining us.
Hi, Kamal. Thank you for introducing yourself. Hi, Denise. It's so exciting to see people from all over. So High Desert Clinic, actually our fellows go there to rotate. Denise loves to dance, that I can attest to. If we could go to the next slide while people are dropping in information about yourselves. This is wonderful. I'll briefly touch upon the mission our group came up with. It's basically on our webpage, and to touch upon it real briefly, we are here to mitigate, to help mitigate climate change and protect our children's health, reducing families' exposure to environmental pollutants, improving equity in doing so, because clearly some populations get affected more than the others, and educating and empowering not only ourselves, but our communities in this important work. And we do this through, or we hope to do this also through research, collaboration, advocacy, and education. Hi, Chris. And then if we could go to the next slide, please. I would really love if each one of you could drop into the chat box. Drop into the chat box why you chose to attend this session, what inspired you to attend today's session, because it's really wonderful to see so many of us gathered for this important work, and love to see what brought you here.
I can share out loud if you would all like, while everyone
I'm
their,
seeing
inspirations in there.
Yes.
Being a physician and also being a preventive medicine physician, just the aspect of being a physician is to try to improve lives and hopefully prevent things from getting worse or from even happening. And with this whole issue with climate change and how it's affecting our patients and our children's health, is really, it's really amazing and really complex and fascinating. And I think that to be on the cutting edge of medicine and what's to roll out before us, in addition to protecting our patients, should a part of it should be us being aware of these effects, having discussions about how we can protect our patients, and kind of being in the front of the line with this topic, be the early innovators, if you will, in that sense, at least from my perspective. Maybe there's a lot of physicians working on this, but yeah, so that's what's inspired me, the prevention aspect, and protecting our kids, because it doesn't seem like this issue is really going to go away. It's only going to become more and more present.
Thank you so much for sharing. And I hope we get to talk a little more as a group towards the end as well. I see a lot of folks introducing themselves. We can move on to the next slide, and then we can have a chunk of time where we can chat more at the end. All right.
So this is just a question to kind of get us started with polls and the interaction. So as far as what is causing climate change, we wanted to hear your thoughts. So what do you think is causing climate change? Mostly nature, mostly human, both nature and human, or you're not quite sure? And we'll put up the poll. Oh, it looks like everyone has answered. So, so I think most of you said mostly human, and some of you said both. So 99.9% of the articles published in the last 30 plus years have agreed that climate change is human caused. And the Intergovernmental Panel on Climate Change formed a group of climate experts and scientists, researchers, as well as an external review team that published a consensus report stating that climate change is human caused. And there have been about 9,000 authors of climate change papers, and only really one of them has disagreed that it's primarily man-made. So when we looking at the next slide, we're just to give like a very brief primer on climate change. So at baseline, we do have some greenhouse gases, and these help us trap heat and keep our Earth warm and habitable. Greenhouse gases like carbon dioxide, methane, nitrous oxides, and fluorocarbons help create a layer that trap the heat and prevent it from escaping into space and keeping it warm. However, humans have been pouring all of these gases into the atmosphere, creating a thick layer that traps even more heat and raises the global temperature, thereby increasing the risk of climate change. So moving to our next question, when talking about gases, which of these gases comprise the largest proportion of the greenhouse gases that we emit? Carbon dioxide, methane, ozone, or nitrous oxide? It looks like everyone's answered. Oh, nope, we have a few more people. All right, so share the results. So most of you agreed that it was carbon dioxide, and we also have some methane and ozone in there. And all of these, it is true that all of these are greenhouse gases that contribute to climate change. However, 80% of the 80% of the greenhouse gases that we currently have are carbon dioxide. So we can look at the next slide to kind of see how they have increased. So sorry, just technical issue. Okay. So this is a graph that shows us the rise in carbon dioxide after the before and after the second industrial revolution. And the time frame of the second industrial revolution is open to debate, but it's thought to be sometime around the mid 1800s. And that's when fossil fuel consumption rapidly increased. So as you can see, up till the mid 1800s, there was a pretty low state. And after the mid 1800s, there's a sharp spike. So one of the problems with greenhouse gases is that they stay in the atmosphere for varying lengths of time. So carbon dioxide can stay for hundreds of years in the atmosphere. Other gases like methane might stay for 12 years. However, depending on the chemical composition, some gases are more potent than others. For example, methane and nitrous oxide are more potent than carbon dioxide. And the other issue is that the amount of greenhouse gases that humans have been pouring into the atmosphere are outpacing the rate of their decay and absorption. So Karina is going to talk about some of where these gases are coming from.
Thanks. Yeah, so what is causing these greenhouse gas emissions that are heating us up? Most greenhouse gas emissions are produced by the burning of fossil fuels for energy. So next slide, please, Thomas. So the pie chart from the EPA that you see here breaks down the sources Most of them generate greenhouse gases from burning fossil fuels, whether it's for transportation, electricity, the power needed to manufacture products under industry here, or heating and cooling under residential. And the US is the second largest greenhouse gas emitter in the world, contributing 15% of the world's CO2 emissions, even though it only has 4% of the world's population. Number one is China at 28%, then Europe, India, Russia. But the US, by some big distance, is responsible for the largest share of CO2 emissions from 1850 through to the present time, according to an analysis published just last week. Next slide. And then this animation from NASA illustrates how our planet has warmed since 1880. It's a little video that you see the progression over the years and decades. It represents the change in temperature, the change, so the delta. For example, the north, you'll see, has warmed much more than the equator. So it's not all evenly distributed around the globe. But the last 20 years, 19 of them have been the hottest years ever measured with instruments. The 7 hottest of all have been the last 7 years. And we just experienced our hottest summer on record in California. So getting hotter. And the rise of temperatures in our oceans looks very similar. Human activities are estimated to have caused 1.1 degrees C of global warming so far, above pre-industrial levels. And we are likely to reach 1.5 C sometime in the next few decades if we continue at the current rate. And the extra heat might not seem like much, 1 degree C, 1.5, but it's injecting energy into our natural systems, intensifying weather patterns, driving regional and seasonal temperature extremes, unevenly distributed over the globe, and reducing overall snow cover and sea ice. So sometimes there are Arctic blasts that occur due to the changing jet stream patterns, but this still represents an effect of global warming, or some people call it global weirding. And this is the difference between weather and climate. Next slide, please. This next slide shows a map from NOAA, so the National Oceanic and Atmospheric Administration. And it shows the cost of these climate pressures. So it illustrates weather events in 2020 with losses exceeding $1 billion. There were 22 separate billion-dollar weather and climate disasters across the United States, including wildfires, drought, heat, severe storms, flooding. This shattered the previous annual record of 16 events in 2017 and 2011. The 22 events last year cost the nation a combined $95 billion in damages. And these are direct costs for damages to homes, businesses, vehicles, crops, infrastructure, etc. They do not include indirect costs such as health impacts. A new report finds the financial impact tops $820 billion in health costs each year, so 10 times the direct costs, and those amounts are on track to increase in the future. And these are just from the weather disasters. It doesn't include all the effects from pollution, the health impacts and costs from pollution. Next slide, please. Here's a graph of worldwide extreme weather catastrophes. So it's not just the US that's suffering, but this is the whole world by number of events from 1980 to 2020, so the last 40 years. And they're increasing markedly, as you can see. Next, we have a poll for you to take about the effects of these weather events.
Thanks, Karina. So the question is, over the last 30 years, which climate-related extreme weather event has caused the most deaths in the US? Heat, floods, tornadoes, hurricanes. So that's great. We are talking to a very educated crowd already. And heat-related events have been the most, have contributed the most to deaths in the US, and actually even worldwide, the number of deaths is the highest with droughts. And it's known that extreme heat causes droughts mostly, so it's attributed to heat. In the US, annually we have around 600 deaths because of heat-related illness. And cumulatively over 30 years, it's just the highest number, which goes the top among the top 10 weather-related deaths. Heat-related deaths vastly outnumber the others combined. If we could go to the next slide. So you may be wondering, why are we talking so much about the climate, and how does it interplay with what we do on a day-to-day basis, thinking and protecting our children's health? But as time has moved along, we have just realized, and the science and evidence is just mounting in terms of the clear, direct as well as indirect pathways in how what we see on a day-to-day basis in the clinic and in the health of our country that can be linked to climate change. So this slide really puts together some of the highlights of what we see downstream and how they translate to the effects upstream in terms of the different climate pressures. So I'll just touch upon a few things. The expanse is a lot. The things I wanted to draw attention to are, you probably see kids with heat illness, heat stroke, more during summertime, particularly if kids are involved in outdoor activities, sporting activities. And that's been attributed to extreme heat and heat waves, and that's caused because of the climate pressures of increasing temperatures and extreme weather conditions. So heat can be extreme heat, and then cold can be extreme cold. But here in Southern California, extreme heat is what we worry about mostly. Similarly, vector-borne diseases, you might be seeing clusters of, say, West Nile virus, whereas previously you may have not seen, or like mosquito-borne illnesses, tick-borne illnesses in larger proportions in your practice. And that's known to be driven by changes in vector ecology because of the changing weather patterns. Insects and vectors which would have not normally thrived in certain areas or locations are just moving along the coast, or like upwards or downwards, depending on what the weather patterns are. And again, that's because of different climate pressures and changes in weather conditions. And one growing and very concerning aspect is the mental health burden on our children. And it's just becoming more and more evident. You see news articles of this, and it can range different age groups, but particularly in the teens. And there could be several reasons for it, but you can imagine that someone who may have been displaced because of, well, like in Southern California, again, you could say wildfires or extreme weather conditions. In some other places, like which have hurricanes across the country, could wreak havoc on kids' health because the events are becoming more frequent. So the same population might be affected more frequently as well, and the cumulative impact on the child's mental health can just escalate because of that. So it's very real. We are seeing it on a day-to-day basis without even realizing that it's actually climate that's driving a lot of these issues that we see in our clinic or in society. If we could move to the next slide, please. So as pediatricians, we all know we work with a population which is very vulnerable, and it's unique because they go right from prenatal stage to adolescence, and each stage of development really is vulnerable for different reasons. So this is a nice graphic that shows what kind of impacts you could have at different stages of development. So it goes right through from the prenatal stage, where exposures can cause long-term health effects like miscarriages, low birth weights, preterm labor, and then you could have some like congenital defects as well that have been associated due to pollutants and climate-related issues. During infancy is when you have some spillover from like the prenatal risk, so increased risk of death, particularly from heat-related illnesses. And then because it's the body is still growing and vulnerable, the environmental impacts of pollutants can have long-lasting effects on their health. During childhood, we've seen asthma exacerbations and other diseases and conditions like allergies that can become more frequent and affect larger populations based on where they live. And then in adolescence, as I mentioned, in addition to all the potential things that kids in infancy and childhood can face, they have this growing concern of mental illnesses and how that can play a role in their adulthood as well. If we could go to the next slides. Okay. Aditi.
So even though it affects all of us, obviously there are some, like every other medical condition or public health concern, certain populations are more vulnerable. So low income communities and communities of color face structural inequities that make it more difficult to adapt to climate change. And people with chronic diseases, disabilities, and the oldest and the youngest of the age spectrum can also be affected. So race and ethnicity, socioeconomic status, our age and education are all factors that affect our health outcome and our ability to respond to environmental exposures such as climate change. And as I'm sure we've all heard, our zip code does have a greater impact on our health than our genetic code. And so it's really important when we're thinking about climate change to make sure we find equitable solutions as we move forward. And this is really important to secure a healthier future for our children. So the AAP actually released a statement about this. If you could go to the next slide, please. About 6 years ago, the AAP released a statement calling on pediatricians to advocate for societal change to improve child welfare. And this position paper offers multiple suggestions on how pediatricians can improve, advocate for climate change in different ways, including greening their healthcare facilities or partaking in educational opportunities, and building coalitions with community organizations and the government. And I'll bring in the link as Karina starts to talk a little bit more about solutions that we can look forward to.
Yeah, thank you. And it's at the end too, I think, Aditi, and on our website. But when we think about how to apply this knowledge to our everyday pediatric practice, fears of polarizing politics. Oh, could you change the slide, please, Tamar? Fears of polarizing politics might creep in. However, when we know the facts and focus on the health impacts, this is something most people, especially parents, are concerned about. Surveys have shown time and again that Americans are concerned about pollution's impacts on health. This is really important because we know that when people make the connection that climate change is impacting their own and their family's health, they are more motivated to act. Next slide. And healthcare professionals are, as a group, some of the most highly trusted professionals. On this graph, you can see nurses and medical doctors rank at the top at 85% and 65% respectively. It's a bit of a drop. Maybe we've suffered some damage during the pandemic, at least amongst certain groups, but overall, health and medical professionals are trusted voices. Next slide, please. So in summary, the climate change is here. It is now. It poses a health threat to all children. And as pediatricians, we have an obligation to be knowledgeable about how climate change is affecting children in order to protect and optimize their health. So how do we do that? Next slide, please. Here are some solutions, some positive actions we can take. Educate yourself on the health impacts of climate change is one, by attending this. Address these impacts in your practice, and in other sessions, if people are interested, we can go into more detail on that. Share what you learn with your colleagues. Take steps to make your clinic or hospital more environmentally friendly. Meet with your legislators, write letters, give public comment on important issues, because our health voice really does matter. And perhaps most of all, vote. Historically, physicians have lower adjusted voting rates than lawyers and the general population, suggesting reduced civic participation. Next slide, please. So now we ask you, what is one commitment you can make today to address climate change? So please put the commitment you choose in the chat. It could be, for example, educating yourself more by attending our next session, or some of the many webinars available on climate change and health. There are a lot once you get plugged in. Considering the health impacts of climate change on your patient's health while working in the clinic or hospital, because as Priyanka said, many of the conditions we see every day, we don't necessarily make the link that it's due to climate change and what's happening in our environment. So when you have that kid brought in with an asthma attack and the parents say he was fine this morning, I don't know what happened. He went outside to play at school. They called me to come get him. I mean, that happens all the time. And you look at the air quality index and it's high and the air is polluted. And that's the reason the kid is having an asthma attack. So every day, this is happening, but it's whether we recognize it and help our patients to take care of our kids and prevent these things as much as possible. Some other things you could do, starting a research project that involves the health impacts of climate change, joining your medical center's green team or sustainability team if they have one, or create one if they don't. You can even take small steps to green your own practice. Join our committee, the AAP California Chapter 2 Climate Change Committee. Our contact info will follow this slide, and we invite you to reach out to us. We formed the committee, as Priyanka said, just 1 year ago, so we welcome additional members and ideas.
Yeah, thank you so much for putting in your commitments in the chat box. All are very relevant and will move the needle. We are a growing committee, hopefully, and would encourage your participation if you have interest in whatever form, like if you want to take more leadership interest, more leadership role, you want to just participate in like getting educated and educating your patients. There are many things I think we can do as a committee, and the larger Southern California AAP pediatricians, I think together we can do a lot more things. Individually, our committee members do different things. So we are happy to talk to you more about it and have you also participate in one or more of those activities if there's scope. So yeah, feel free to reach out. And I think what would also be helpful is if you cannot, like if you do not feel this is the right time, maybe even giving suggestions of what would you like to see in future, or if you had countless time, what would you like to see from the committee. Not we all have limited time, so we'll have to prioritize what we offer. But I think it's a great starting point, and we really would like to hear from you guys as well. Yeah, and here we have our email addresses. Feel free to reach out at any time, and some resources.
Thank you for the presentation. It was really beautiful, well done, and I like all the Halloween theme throughout. It was very nice break from from the day to see all this important information supported with all of the stuff. I would like to in the future get more information on how to give empower patients with this kind of information. Like what can we tell our parents and families about the situation and how they can reduce impact. I definitely can, I guess, like imagine a few things, but I don't think I have a good resource on how to do that better. And I think in the chat, someone asked what families could do. So I think we could also, I guess, tie that in together, what to say to families as a provider, and then what families can do to empower themselves and protect their family and kids.
Yeah, I think that's a very interesting point you make, Denise. On the one hand, you want to engage families because when they are coming to the clinic, that's probably not the best, like it's a good time to engage them, but they are thinking about controlling the asthma attack and are not necessarily thinking climate change. Exactly. But having that conversation on a regular basis and also working in our communities, not necessarily within that clinical space alone, might really help, help them to participate in times when they are not stressed. That's what some of the pediatricians have suggested as well on different meetings. Like sometimes it's just hard to, in the clinical setting, if like the parent is at a thing where they just want to deal with the crisis at hand. Yeah. So there are multiple prongs. That's what I'm trying to get at, that where we could engage families and parents.
Great. Yeah. Thanks, Priyanka. Thanks, Karina, for the resource.
Yeah, that's one resource thing. Thank you for that question, Denise, because I think that's the one most people ask and that we need to help answer. And we're happy to go more in depth on, because each of the effects, for example, air pollution or heat or vector-borne disease could be a talk in of itself. And there are lots of talks if you look them up, or we can help you find them too, to listen to the recordings. But in terms of having practical information on hand, that's easy to use and reference and remember and maybe even give your patients, that is a little bit lacking, and a lot of us are working on that right now. So the reference I put is one really handy one, and then Aditi and some others, there's a group, a larger group. This is our chapter 2, California chapter 2 climate change committee. There's a national AAP climate advocates group. And then within that group, Aditi is working with some others on creating handouts for patients, one sheet or maybe DT can talk more about it. And then there's also on the MOC recertification board, maintenance of certification, we're working on a module, one of the MOC4 practice improvement modules that will have practical information for how to counsel patients, how to treat them, how to help families prevent the health impacts on their kids. So that will be coming soon. I don't know, Aditi, if you want to talk more about your other project.
Yes. Well, we're basically what Karina said. We're putting handouts on, or putting patient handouts that are like basically one page, and it's kind of done across the United States. So there are some that might be more relevant to what we're currently experiencing in California versus some that we might have to experience in the future. But there will be some on smoke and wildfires. I'm working on the one for wildfires, and then the PACU, the Pediatric Environmental Health Specialty Unit, also has a toolkit for pediatricians, as well as some information that that can be given for parents.
And then Michael Siegel put in the box, I would suggest that at our annual meeting, we include one climate change presentation. At the Chapter 2 Symposium, February 26th, we are going to have a speaker on climate change and food. So I know also Matt Kessler, he is very knowledgeable about food, both for our health. I mean, in general, what's healthy for us is healthy for the planet. It's funny how that works, but so we're going to have Dr. Reshma Shah speak on that. So that'll be exciting if you're able to attend that. Any other thoughts or any other ideas for this committee, how we can help you in your care of patients? You can speak up too if you.
Yeah, you can unmute yourself.
Prefer.
You have a few minutes.
Aditi, also, if you want to mention about the form, there's the link to the form in the chat.
Oh, thank you. Yes, if anyone is, if you'd like to, feeling shy and don't want to speak up or put it in the box, we also have a form where we really would love to hear your answers about what you think is important and what you'd like to see from the committee. And if you're interested in taking a more active role, it would be great if you can fill the form out. So we do talk a little bit about advocacy informally in our climate change committee meetings. So it would be an opportunity. So it would be great to connect at a meeting if you're interested.
Yeah, and for advocacy, a lot of us are involved also with all sorts of other groups, and also just personally, I've done a lot of advocacy at all those levels, and am right now also, so there's a lot of opportunity for that. And I think each one of us on the committee has different things that we're involved with. Priyanka and Aditi are doing some research, and I do a lot of advocacy, and then we all sort of share all of those things.
Yeah, and I think it's nice because Karina does so much of it. Like, even if we are not actively also doing as much as Karina is doing, oftentimes she communicates with us in terms of like gaining, a momentum with other folks. If we wanted to write letters or wanted to speak as on behalf of our patients' health, there are plenty of those opportunities, or like provide testimony on why we think certain things should happen in terms of laws or bills, purely taking the medical and the health standpoint for our patients. So I think it's really nice to be in contact with people who are doing different things and then communicating with each other. For even if you're not able to do a big thing, it's easy enough to like send a letter or give your testimony.
This is Rajashekar. Very nice presentation. I have a question. Any of you are aware of any bills at the state related to climate change at this time?
Oh yeah, so I can speak to that. So this is October, so the legislative cycle has ended. In California, for those of you who don't know, we have a 2-year legislative cycle, and they're busy just about the whole entire year up through October. A lot of states, they're only, the legislators are only active for the first few months. So there were quite a few bills, actually quite a few. Some were passed, others were not. Some were put in this inactive file to hopefully be rejuvenated in January. And I am actively working with a group, which is the one that Trisha put in the chat, Climate Health Now, on various policies, bills. We've met with several legislators, written tons of letters, spoken at lots of public hearings, and so there's a lot going on related to climate change. And in Los Angeles, I don't know if you know, but where are you?
I'm in San Bernardino County.
Oh, okay. Yeah, so I don't know about San Bernardino. In Los Angeles County, there's currently the city council is considering banning all new oil and gas drilling, and Culver City already did that. Kern County is also considering, they're probably the last to kind of go, but there's also been with the Southern California Air Resources Board have taken measures to decrease pollution from trucks at the ports, and lots of things like that. So there's plenty, and if you're interested in getting more involved, you can let us know.
I just want to bring to your attention that our chapter, we have an advocacy committee, so you can collaborate with them.
Yeah.
To get more help, and Tomas can help you with that.
Okay, thank you. Mm-hmm.
Thank you so much. Yeah.
I think something else that would be helpful would be having a talk or exploring the concept of emergency preparedness in the frame of climate change, especially for patients that are more vulnerable.
Yeah, thank you. Mm-hmm.
That's an interesting suggestion. Thanks.
You're welcome.
I think emergency preparedness goes at least 2 ways. One, how do patients prepare for emergencies like a wildfire or flood or mudslide, or depending on where one lives. And then how do hospitals and clinics prepare for climate emergencies when everyone is rushing into the hospital or the clinic, or something happens like a wind event or a fire. I mean, that has happened where hospitals have had to evacuate. Yeah. And
are there other subjects that that you think would be interesting, related to climate change that you would want to hear more about from speakers? Like heat or wildfires, air pollution.
Oh, you mean to me?
You would be great, but I was speaking just generally.
Yeah, I think all of the topics you mentioned, like all of the increasing impacts of climate change and how it's affecting our environment. So definitely in California, like I guess wildfires is kind of the go-to, but really anything else, like there are different changes, like the weather gets very cold or it gets, unstable or something like that. Yeah, fires, floods, so I guess like doing kind of like an overall assessment of what we can expect to see more as a result of climate change. And then, I guess the certain areas that should be having these conversations in their communities to be ready for them. Thanks. Sure.
Anyone, I'm just curious, anyone already know they want to be part of the climate change community? I keep saying community. You guys are part of the climate change committee. Tongue twister. Yeah, please feel free to raise your hand or like unmute yourself, because we are really looking forward to like gaining momentum and moving things along. Yeah.
So a thumbs up from Denise.
I would definitely love to stay in the loop. I'm new out here, so I'm still sort of getting the lay of the land. But the work that you all are doing is so important and something that I'm really excited to learn more about.
Kamal, actually,
where are you, Kamal?
Oh, sorry. Go ahead.
I was just asking where you are, Kamal.
So I live in Northridge, but I work out in Lancaster.
Mm-hmm.
Mm-hmm.
Yeah, a couple of our fellows, Aditi comes to High Desert Clinic, but not at the DCFS. I don't know if they're co-located, but they come to see primary care patients. So there's probably opportunity for us to chat further and collaborate as we move along.
That'd be great.
Yeah, thank you everyone for participating, and you'll be hearing from us both directly and indirectly. We sometimes send out information through the newsletter. We would like to hear from you and really hope to work together in the future.
Yeah, thank you everyone. It was nice to see you, meet you.
Yeah.
Thank you.
Thanks, everyone.
Bye.
Bye.
Bye. Have a good night.
Thank you and happy Halloween.